Hi, I'm Brenda Neiman, the Health Officer for Lewis and Clark Public Health. I'm pleased to announce the 2021 Community Health Report for Lewis and Clark County is now available. The Healthy Together Steering Committee worked collaboratively to issue the Community Health Report. The steering committee consists of partners from Rocky Mountain Development Council, St. Peter's Health, United Way of the Lewis and Clark area, Pureview Health Center, and Lewis and Clark Public Health. You'll hear from these partners throughout the presentation. The purpose of the committee is to work strategically, collaboratively, and comprehensively toward improving the health of all Lewis and Clark County residents. Every 3 years, the committee produces an assessment of public health needs in the county, identifies priority issues, and considers strategies and resources to address them. This assessment results in the Community Health Report. The partnership will monitor and record progress on health improvement annually.
I'm Amy Emmert, Senior Director of Population Health at St. Peter's Health. The overall purpose of the Community Health Assessment is to provide a snapshot of our community on several health conditions, behaviors, and social determinants of health in the county, including cancer, heart disease, substance use, mental health, childcare, food security, and many others. Data in the Community Health Assessment includes responses from the community input surveys and also includes data from other program reports as well as state and federal data.
I'm Haley Weismiller, Population Health and Community Education Specialist with St. Peter's Health. Now I'd like to share some highlights from our most recent Community Health Report. The 3 items that Lewis and Clark County residents view as the most important for a healthy community are access to healthcare services and access to affordable housing, along with good jobs and a healthy economy. There were also 6 priority areas of concern identified for this report. Those are asthma, cancer, heart disease, housing, mental health, and substance use. This report also newly includes information on race, ethnicity, and individual and systemic racism. Each time we complete the assessment and report, the needs change along with the changing health and social landscape of our community.
Jolene Jennings, Behavioral Health Systems Improvement Specialist at Lewis and Clark Public Health. As part of the Healthy Together Steering Committee, we were extremely privileged this year to have an epidemiologist from the public health to lead the efforts on the research and data reference for the Healthy Together Steering Committee Task Force. All members took time to evaluate, research, write, and review various resources to bring this year's CHA, the Community Health Assessment Report, to fruition. And it was an honor to be part of this group that brought much diversity of knowledge and skills to the public health process. Reviewing and defining measurable questions and responses for both email surveys to key providers and phone surveys to residents in the county to contribute to the local and current health information for CHA was a big part of the process. Identifying and collecting the key contributing research to triangulate data findings from local, state, and national data such as Healthy People 2030, Lewis and Clark County Behavioral Health Crisis Systems Analysis 2021, Department of Public Health and Human Services, and the Behavioral Risk Factor Surveillance System called BRCS.
I'm Jill Steele, CEO of Pureview Health Center. The next step in the process is writing and implementing the Community Health Improvement Plan, or the CHIP. This is a community-wide process that uses data from the assessment to identify all the top health priorities in our community. A plan is created with input from community members, and committees are created to address those priorities over the next 18 months. A group of about 80 community partners and residents meet for facilitated sessions to identify the most pressing needs of our communities and draft the Community Health Improvement Plan over the next 3 years. The result of the CHIP process will be a health improvement plan that will describe how participating community organizations and coalitions can work together to improve the health of our population.
Hi, I'm Emily McVeigh with United Way of the Lewis and Clark area. The Community Health Assessment Report is an excellent resource for agencies. The information in the report can help guide screening questions for clients and help organizations plan programming based on community need. The report is also helpful for coalitions to assess the needs and gaps in the community. It is a great resource for grant writing to fund programs and services. United Way uses this report to look at the needs and gaps and learn how they can support and build community impact teams to expand current programs or create new programs to provide the community with the services needed to make sure all of our neighbors are healthy and well. The United Way used the 2018 Community Health Improvement Plan to work on suicide prevention efforts and to improve the 0 to 5 and early childhood education programs in the Helena area. Kelly Parsley, a Carroll College professor, uses the Community Health Assessment and the Community Health Improvement Plan in her class, Public Health Theories and Practice. Students review the document to see what's happening in the community and what are the big issues. They can use this as a framework to learn about community and the topic they want to work on for the class. Then they'll do an academic research, go out and interview local stakeholders, conduct focus groups, and conduct an environmental scan. The Community Health Assessment and Community Health Improvement Plan are where they start, and then anything can happen. The data from the Community Health Improvement Plan has even been used at trivia night at local breweries.
Hi, I'm Lori Lattis, Executive Director of Rocky Mountain Development Council. As a community action agency, also known as an HRDC, Rocky is committed to improving quality of life, especially for low-income citizens in Lewis and Clark, Broadwater, and Jefferson counties. Rocky is required to complete a comprehensive community needs assessment every 3 years. We use many avenues to gather information about the needs in our communities, including the Community Health Report. The information in the Community Health Report is intricately related to the needs of the individuals and families that Rocky serves. We use the information to help inform the programming and services Rocky provides in our service area.
The Community Health Report is available on our public health website or by contacting any one of the agencies represented in this presentation. If you're interested in being involved in the community health improvement process, please email us at publichealth@lccountymt.gov.